It's that time again. It's time for open enrollment, and we're here with Kelly Fristow from Financial Partners, your local insurance expert, to tell us about open enrollment.
Thank you, Ashley. Yeah, this year open enrollment begins November the 1st, and it goes all the way until January the 31st. And so folks that are looking at trying to get back into buying health insurance for 2016, if they are needing coverage, that's the time of the year that they want to see us and do your enrollment.
Kelly, how important is it to make sure you get enrolled during this time?
Well, it's very important because this year, when you decide you don't want to enroll, there's going to be penalties involved. There's been folks that haven't enrolled in the past 2 years with the Affordable Care Act coverage. The individual mandate started January 1st of 2014, and there have been people that have chosen to pay penalties instead of buying the coverage. This year, the penalty is pretty significant. The penalty goes to 2.5% of your household income. So in 2016, if you decide not to have coverage, you'll pay a pretty hefty penalty for that.
Okay, Kelly, we've seen on the news stories that there's going to be some big changes for 2016. What are those?
Well, you're right. There are some big changes. You know, there's two ways that you can enroll, two paths. One that we've talked about previously is going through healthcare.gov to do your enrollment if you're eligible for a tax credit or a cost-sharing reduction subsidy. And we can help people go through that enrollment process, and it's a pretty lengthy process, pretty involved. There's also the process of going straight to the insurance company and enrolling in their plans there. That's going to be suitable for the person that isn't going to qualify for any sort of a tax credit or cost-sharing reduction subsidy. So basically, Blue Cross Blue Shield has been a carrier, an insurance company here locally that most people are buying coverage through. And we're seeing that those plans that have been purchased previously are PPO plans, giving the insured access to a very wide network of providers. Our hospital systems here locally are both network providers. For 2016, that is going to go away. We're going to see very restrictive and narrow networks of providers. We're going to have a platform now that's called HMO, a health maintenance organization. And that's going to limit the number of doctors that people are going to be allowed to see. Here locally in the Wichita Falls area, we have approximately 11 doctors that are primary care doctors. And an HMO works a lot differently than a PPO, and it's going to be very incumbent upon the consumer that's buying the coverage to know exactly what the details are with that coverage so that they'll know how to use it best. An HMO system can be very workable in our market, but it requires the consumer to really and fully understand the terms of their contract. So I'll describe that real quick. What that looks like is an HMO says, basically, that when you go see a doctor, you must go to a primary care physician, one of these 11 or so doctors that we have locally. That's where you have to go in order to have benefits. If you try to go to a specialist or to the doctor that you might be using currently as a primary care doctor, your family practice doctor, you won't have benefits. So you go to your primary care physician, one of these 11 or so doctors that we have here locally, and maybe you need to see a specialist. In order to see a specialist, a urologist, a neurologist, an orthopedic doctor, an endocrinologist, you have to be referred to those specialists by your primary care doctor. So once you get to that specialist, then you have benefits under your HMO, only through that referral process. So you know, change is hard for people sometimes. Nobody likes change, but in this new environment, we're going to find that the HMO plans that are going to be made available to people through Blue Cross Blue Shield are probably and very likely going to be the most affordable plans available in our market.
Kelly, in this new environment that you just described, how is the best way that someone can educate themselves on this on their new policy maybe that they're going to get?
Well, that's a good question because policy language is complicated. We here at Financial Partners, we are dedicated to our customers in spending that necessary time with them to educate them. That's the counsel that we're going to provide our customers through this open enrollment period. You know, there's only going to be 45 to 90 days here that we have to make these changes, to see all of our customers during a short period of time during open enrollment in order to have this conversation. So, you know, the community needs to reach out to their agent, to their professional health insurance agent, call us. You know, we're happy to have that conversation with them, but we will provide them that educational component. We've met with providers, we've met with hospital systems, we've had conversations with pharmaceutical companies, with formulary lists. We are familiar with those drug lists, and drug lists are changing constantly. So if you want to know whether or not your drug is covered, we have the answer to that. An 800 number probably is not going to have that answer for you to make that educated decision on what coverage options are best for you.
Kelly, it looks like people need to pick up their phones and give you a call because there's just a short window of time that they can sign up for open enrollment.
That's true, and we're going to be working many hours through the week on Saturdays, Sundays after church. Our phone number is 940-322-6277. So pick up the phone and call us. Let us educate you on how to use these new benefits for 2016. You can visit our website at www.financialpartnersonline.com.